Very much. See you later.
Thanks.
It's 8:15 now. We have spoken a lot on this programme about the challenges which face NHS dental care in England. Some people are turning to extreme measures to deal with problems with their teeth.
In Newcastle, a number of charities have come together to find a temporary solution to the problem. This is a mobile dental bus which treats adults and children for free. Our reporter Anna Collinson has been to see how it works.
You're doing great.
Getting into a dentist is hard. I like looking after my teeth, and this is what comes with it, having to have two teeth taken out. Just wish I had a dentist.
A lot of the children there had more than 4 decayed teeth in their mouth. All of them do need treatment and should have been seen a long time before this to prevent any of that happening.
This bus is a temporary answer to a growing dental emergency, led by the charity Dentaid and supported by an army of volunteer dental staff and students.
Also a lot of fear. We're trying desperately to break down those stigmas, and because it's in a mobile unit, we're taking the vehicle to them.
Good boy.
The 5-day service is based at Newcastle Food Bank.
Our clients see dental treatment and, to a degree, medical treatment as a complete luxury. They are fighting daily to feed and clothe their children, try and survive in this current cost of living crisis. We had those appointments filled in 2 hours. We could have filled that dental bus 10 times over.
Wetting.
Really anxious about it.
Really bad.
Michelle has just 8 teeth left.
Everyone funny say, oh.
Many need to be removed.
You haven't been to the dentist for 30 years. This is your first
Oh,
time.
a long time. A really long time. I've got this fear, I just don't know what it is.
And is it giving you pain?
But bringing dentists to a place she trusts has helped break that cycle.
Just open for me
She also brought her son Gary,
and close.
who's deaf.
Just move your head this way.
Straight away, he's able to get a temporary cover on a rotten tooth.
You okay?
The plan is that you're both going to have treatments at a dental hospital.
Yeah.
But that is going to take months, isn't it?
Rather that than we wouldn't have done it at all. Would have just been in limbo.
Nice and waggle, rah. Well done.
1 in 3 children live in poverty in the northeast of England,
D, E decayed. On the lower left, E decayed, D decayed.
which means poorer overall health.
It's really harrowing to see the amount of kids that come through where there are just sheer amounts of decay. It's really hard when you're taking out 10, 12, 15 teeth on one child, some of whom are as young as 2 or 3. I still get really upset when you think, oh, what a shame that this is a preventable problem.
Put some fluoride varnish on your teeth and make them nice and strong.
There's a big drive to reach the young,
You're doing amazing.
so any child can come for a free checkup.
Well done.
These are amazing.
5-year-old River has toothache.
There it is.
Can you point to the sore tooth for me?
She's missed 6 days of school.
We've got 1 abscess.
Dr. Taylor finds she needs to go on the bus for further treatment, which we'll see shortly.
I'll be as gentle as I can, okay?
We've seen many in pain, like Moki,
Open.
Every night I can't sleep and I can't eat properly.
who didn't have an appointment.
I always ask about the dentist. They say, is it full, is it full, is it full, is it full, you know? Every time when I want to see the dentist, they say, is it full?
Luckily,
Coming out.
the team can fit in an extraction, while a cracked tooth is removed for Sheila, who's not had an NHS dentist for 2 years.
Today it's meant the world to us having this done.
A bit of time, pain-free, a nice night's sleep. And what does that mean?
I mean, everything. Yeah.
Oh, River, it's raining.
It's now River's turn to board the bus.
Yeah.
Her infected tooth needs removing.
Wiggle, wiggle, wiggle.
It's out, done.
That is a big tooth.
That was, I mean, hard to watch, let alone do it.
It's the right thing for her to have that tooth taken out. There was an abscess with it, it was infected. She's been up for the last 4 or 5 nights, and medication Carpal's not even touching it.
This project has brought short-term respite to this dental desert. But the government says it plans to bring in mobile dental vans. Just hours later,
Where are we?
River is home and happy.
How are you feeling at the end of today, River, would you say?
10 out of 10. I'm a poop girl.
Our reporter Anna Collinson is on board that very bus. Anna, good morning to you. You know, you cannot underestimate the pain of toothache and how it just takes over everything. So you can understand why people will be so pleased to see something like this today.
Yeah, absolutely. It's we're not actually on board because they're busy setting up, so we're stood outside, but hopefully you got a gist of what it's like inside in that piece. It's day 4 of the Dentaid bus being sat outside food banks in Newcastle. The weather is pretty decent today, and the hope is that they can continue to reach more people who are in desperate need of dental care. While I've been reporting this week, I've been stood in this spot, and passers-by have approached me and asked me how can they get an appointment, which really gives you a sense of the level of need in this area. Now, joining me now are 2 people who help make this happen. This is a huge team effort. I'm joined by Dr. Simon Stone from Newcastle University and Carol Rowland from Newcastle Food Bank. Thanks so much. Simon, can I start with you? You're one of the dentists that has volunteered this week. What have you seen?
Well, we've been working with the food bank this week in order to provide some simple dental care for the patients that really need this sort of service. We've seen around 120 patients so far this week. 80 of those have been children. For that group, we've been providing some simple preventative dental care advice. That's included some fluoride application on children's teeth, and also we've been working with the families in order to provide some simple advice at home. Things like toothbrushing, which is supervised by parents, but also some dietary advice to try and reduce the amount of dental disease within the community.
That's brilliant. And Carol, this is the longest time this Dentaid bus has spent in one city. How did all of this come about?
Good morning. Newcastle Food Bank is also an anti-poverty charity, and we help holistically. We literally have partnered with Newcastle Hospital Charities, with the Dental Hospital, with Newcastle and Northumbria Universities, and we've been planning this for up to a year. And we have many clients who present every day with, unfortunately, abscesses and dental pain, and it can be very difficult to get them an appointment. So we are absolutely thrilled that this has happened, and our clients, believe you me, are so, so grateful. I'd also like to say a big thank you as well to a little charity called Project Linus, who've knitted blankets for us this week to give to every child, and we are so grateful to them and all the dentists, the nurses and the students who've given up their free time to be here. This has changed lives, and we are so grateful. Thank you.
And there's currently no plans for this bus to return at the moment?
There certainly isn't, but if anybody out there has any influence, we need your help. Thank you.
That's brilliant. Well, thank you both so much for your time. They've got another busy day ahead of them, so I'll leave you be so you can get back to work. And I just want to say thank you to all the patients and the staff who've allowed us to follow their journeys this week. It's been a real privilege. They've been very brave, and yeah, it's a week I won't forget.